Morning, everyone. We have a very exciting morning for you all. So it's with great pleasure that I introduce you to Dr. Michael Klaper. Dr. Klaper is a gifted clinician, internationally recognized teacher, and sought-after speaker on diet and health. He graduated from the University of Illinois College of Medicine and served a medical internship at Vancouver General Hospital in British Columbia, Canada. He received his postgraduate training in surgery, anesthesiology, and orthopedics at the University of British Columbia Hospitals in Vancouver, and in obstetrics at the University of California Hospital in San Francisco. He's licensed to practice medicine in California and Hawaii. I would say you're very well trained, Dr. Klaper. After a 50-year career as a primary care physician, Dr. Klaper's full-time focus is now the nonprofit Moving Medicine Forward, which provides education for medical students, physicians, and physicians on the use of diet and lifestyle practices to prevent and often reverse chronic disease. Dr. Klaper presents effective diet-based strategies to help resolve hypertension, obesity, type 2 diabetes, and many inflammatory and autoimmune conditions. He teaches that health comes from healthy living, and he is dedicated to the healing and flourishing of all living beings on our planet. He's also a longtime radio host and a pilot. He served as nutrition advisor to NASA's programs for space colonists on the moon and Mars sometime in the future, and on the nutrition task force of the American Medical Student Association. He's author of Vegan Nutrition, Pure and Simple, producer of the Masterclass in Applied Plant-Based Nutrition and Disease Reversal, and has produced numerous health-based videos and webinars. He's authored articles for both scientific journals and the popular press, and has contributed to making 2 PBS television programs, Food for Thought and the award-winning Diet for a New America, based on a book of the same title by John Robbins. A member of the American College of Lifestyle Medicine, Dr. Klaper currently serves on the advisory board for the Plantrition Project and for the International Journal of Disease Reversal and Prevention. You can also access more information on Dr. Klaper from the Moving Medicine Forward website, and other valuable information on nutrition, health, and balanced living can be found on drklaper.com. He has been an ambitious speaker on an ambitious speaking tour over the last 10 days. We are so lucky to have him here at Queens. Is doing over the last 10 days speeches and presentations at multiple medical schools in the New York area and for the public. So we are really honored and privileged that he's spending the better part of today with us. Without further ado, Dr. Klaper.
Thank you, Dr. Stein-Albert, for that lovely introduction, and for the administration of this noble institution, for the invitation to spend this morning with you. I'm really honored that you all came, and hopefully want to make this hour together worthwhile. The topic is what I wish I learned in medical school about nutrition. Let's see if we can make that disappear. Okay, and any possibility of making the, maybe I shouldn't mess with this right now. Okay. Yes, many of my colleagues feel the same way, that we got through our very adequate medical education, but no one really mentioned to us the importance of what our patients are eating and the role it plays in both creating as well as reversing the diseases most of us spend our professional. And the invitation is to have your cell phones handy. There's going to be some slides going by that you'll say, gee, I wish I had a picture of that one, so feel free to do that. This is not going to be a highly structured scientific lecture. This is more a report from the front lines of medical care. I've been a practicing physician for the past 50 years. I graduated in 1972. Yes, we had penicillin back then, and jet planes and fire and all the accoutrements of modern civilization. What I want to share with you today, as you're about to go into practice or are knee-deep in the early years of your practice, is to share with you lessons that I could not have known 50 years ago. But if I had known what I'm going to share with you now, this is the lecture I wish someone had given me 50 years ago. It would have changed every diagnosis I made, changed every treatment plan I recommended, it would have changed the course of my medical career. And that's why it's such an honor to share this with you today. Because the reality is, and lesson number one, most important take home, is that most of the chronic diseases that all of us, no matter what your medical specialty is, that most of us spend our professional careers treating in the office, in the operating room, in the outpatient clinic, the obesity, the atherosclerotic vascular disease, the type 2 diabetes, the autoimmune diseases like lupus, these are reversible diseases. I wish someone had told me that hypertension is reversible. I wish someone told me that type 2 diabetes is reversible. Instead, in pathology class and physical diagnosis class, we learn to basically chase numbers. I spent the first 6 years of my medical career chasing my patients' increasing body weight, their blood pressure, their blood sugar, their inflammatory markers. And of course, my dosages of insulin and prednisone and anti-inflammatories followed right up with those increasing numbers, because I was doing what I was taught to do, and that was do battle with the classic ogres of disease that we get introduced to in second year pathology class, ogres like high blood pressure. And the standard description of this disease is, well, we don't really know the true cause of it. And I will grant, we have not teased out every interaction between every gene and every enzyme. And there's a world of discoveries that need to be made on that level. And bless those researchers that are in the labs at NIH trying to tease out all the molecular mechanisms. But to say we don't know the cause of this disease, I think does ourselves as practitioners and our patients a grave disservice. And the message that we give our patients is, well, we don't know the cause of it, but if we don't treat your high blood pressure, you're going to have a stroke. You're going to have just heart failure. And so we've got medications that will just pound these blood pressure numbers down. And when the patient says, how long do I have to be on these pills? The message we give them is, you will take these pills the rest of your life. This is lifetime medication. Nobody gets off blood pressure medication. What a dismal message to give our patients. You see their shoulders slump, and you are now going to be a professional patient. You are never going to get better. You'll have to deal with this disease the rest of your life. Well, the antidote to that message was delivered to us by an American composer, George Gershwin, in his opera Porgy and Bess, who said, necessarily so. And the reality is that absolutely, this is reversible disease. You have people who are overweight, eating a high salt, high fat diet, their arteries are clamped down. You get them on a low fat, whole food, plant-based diet, they lose the weight. The potassium and magnesium in the plant foods work their ways into the walls of the arteries, the muscles relax, the artery dilates, blood pressures come down. And not only can you get these people off their medication, you have to get them off because they no longer have the disease. They'll stand up. And the normal compensatory mechanisms, when we're lying down, the blood's pretty evenly distributed. But as soon as you stand up, gravity starts pulling blood down to your legs, and we would all pass out from lack of blood flow to the brain. But the body senses it and compensates. The heart starts speeding up a little bit, the blood vessels squeeze a little bit, keeps the perfusion going up to the brain. But beta blockers keep the heart from speeding up, and the calcium channel blockers prevent the blood vessels from constricting. And as a result, those arteries stay wide open, the blood pressure goes down to their roots, and they do get lightheaded, and they will pass out. These people no longer have the disease of hypertension. You have to get them off. We get people off high blood pressure pills all the time. Same thing happens with our patients who develop obesity, and their insulin receptors are all clogged up with fat. I'll show you that in a few minutes. And insulin is not working well, and their blood sugars go up. And the adage, we don't know the cause of it, but we do know that once on insulin, always on insulin. No one gets off insulin. Nonsense. Again, you get these people on a healthy diet, they lose the weight, their insulin receptors open up. And not only can you get them off the insulin, you have to get them off. They will have severe hypoglycemic reactions on you if you don't. And the poor patients with the atherosclerotic vascular disease, plaques in their coronary arteries, walk up a flight of stairs, their heart is beating faster, the clogged arteries can't deliver the blood and oxygen to the heart muscle, and they get this crushing chest pain of the angina pectoris. And the cardiologists, when you ask them the clinical course here, oh, this is a relentlessly progressive disease. They're all going to need stents. They're all going to need bypasses. That's right, doctor. You don't talk to them about what they're eating. That's what you're going to see. But it doesn't have to be like this. This is reversible disease. You can melt those plaques away from the inside, and I will show you examples of that as we progress. So this is an exciting time to be practicing medicine, knowing that these major ogres that we have to deal with are actually quite reversible. Thank you, Mr. Gershwin, for giving us the courage to consider this reality. The German philosopher Goethe said, what you know about, you see. Once you know about something, you start seeing it everywhere. And what I want to do today is increase what you know, so when you get back out in an outpatient clinic or in your clinical office, you start seeing the reality of these diseases that we are basically just treating symptoms. And so my message to the medical students, to the residents are, no matter what specialty you go into, family practice, emergency medicine, general surgery, anesthesia, OB, urology, doesn't matter. When you open up the door of your waiting room to peek in there and see who's waiting to see you with their various diseases that they're going to want you to do something for them to restore their health. What's the reality of this patient population in this modern time? The majority of them are going to be overweight, if not clinically obese. This is America in the 21st century. You're going to see fluid atherosclerotic vascular disease manifesting as obstructive symptoms, claudication, angina, but also elevated lipids, elevated blood pressure. You're going to see rampant type 2 diabetes in all its glory, and a host of inflammatory diseases affecting every organ system, from lungs to guts to joints to immune system. Welcome to Western medicine in the 21st century. And without casting any aspersions on our patients who we love, when you open the door of the waiting room, who's sitting there? Mr. and Mrs. America, overweight, hypertensive, atherosclerotic, insulin resistant, and inflamed. This is our patient population in this current day. Why is this happening? What is going on, and what can we do about this? I got a strong insight into this because I spent 8 years as an attending physician on the staff at True North Health Center in Santa Rosa, California, about an hour north of San Francisco. And at True North, it's an inpatient facility. People would come and stay 2, 3, 4 weeks or longer. And in this noble institution, we received the same river of standard American, well, they weren't just American, they came from around the world, India, Ireland, Indonesia, and overweight, diabetic, hypertensive, clogged up, and inflamed. But instead of treating this population with increased dosage of beta blockers and insulin, what we did at True North is put them on a diet of whole plant foods. Every morning there was a big pot of fresh oatmeal, steel-cut oats with lots of fresh fruit, slivered almonds and sunflower seeds, and a variety of plant milks, oat milk, hemp milk, rice milk, or on the cereal. Every lunch, every dinner had big colorful salads, hearty vegetable soups, big plates of steamed green and yellow vegetables, and a variety of filling entrees, no cheese burritos, no oil stir fries, and curries, and chilies, and stews, and soups, and lots of fruit for dessert. And we encourage them, eat all you want. There's no calorie restriction, no carb counting, because the physiologic, the botanical reality of whole fruits and vegetables, they're mostly fiber and water. And the calorie density is so low that if you go back for a third bowl of vegetable soup, who cares? It doesn't matter. You're going to pee it right out. It doesn't stick to you. And that's the beauty of this type of eating. It's just guilt-free eating. Eat, my child, eat it. I want you to walk away from the table satisfied. This is the food that disappeared down these patients' gullet day after day, week after week, sometimes month after month. And the changes we saw in these people was nothing short of spectacular. The weight began to melt away within a day or two. They would lose 2 pounds a day for the first couple of weeks, and it would drop down to 1 pound a day. This is Emily. She came in at 190 pounds on 30 units of insulin and 2 medications for blood pressure. We give these folks cooking lessons every day, and so that when they went home, they could continue this style of eating. She continued eating a whole food plant-based diet. And 16 months later, this Emily turned into this Emily, lost the weight, but also lost her hypertension, diabetes, and got off her medications. It's an anti-inflammatory diet. Carl came in with not only a significant overweight problem, but inflammatory arthritis. Again, went on a whole food plant-based diet, spent some time in the gym. 14 months later, this Carl turned into this Carl, and he was free of his joint pain. With all the fiber in the fruits and vegetables and the legumes, the beans and peas and chickpeas and lentils, these folks have their first good bowel movement in years, and it improves their outlook on the whole universe. It was great to see. It's an anti-inflammatory diet. Skin conditions, eczema, psoriasis disappeared in front of our eyes over the course of a few weeks. Ali came in with really severe psoriasis and a bit of psoriatic arthritis, learned how to eat whole food plant-based, and 14 months later sent us this picture. He lost the weight, but showed us his clear skin. I'll show you some pictures later. And his psoriasis was essentially put into remission. The bronchial membranes also respond, especially when you get the dairy protein out of the diet. And our asthmatic folks, like Eli here, came in looking like this and using his albuterol inhaler several times a day, learned how to eat whole food plant-based, did a little time in the gym, and it took about a little over 12 months. And not only did he look like this, but put a stethoscope on his chest, and not a wheeze do you hear. They're sleeping better. We got these people off the majority of their medications. And what I was looking at was a concept called disease reversal. I have to kind of smile in that when I look at the weight reduction program on television, and they show these before and after pictures, but there's a little crawler on the bottom of the fine print. These results are not typical. These results are typical. This is what we see on a regular basis. If this doesn't happen, we get concerned about what the patient's really eating. We have to ask them to bring in a 3 or 5 day food diary. Let us know what you're really eating. But this really typical results. And disease reversal. I practiced medicine for almost 30 years before anybody put these two words in the same sentence for me. This is not a California woo-woo concept. We are talking about remission of clinical symptoms. The joints stop hurting, the lungs clear out, and their lab results normalize. Their inflammatory markers go normal. The lipid panels normalize. This is an exciting thing to witness, and it's a goal that both the doctor should be aware of and strive for, but to share it with your patient. Every week, I get to lean across my desk and say the words that none of my professors ever said, most practicing physicians never say. I can lean across and say, I'd just like to get rid of your high blood pressure. I'd just like to get rid of your diabetes. I'd like to get rid of that inflammatory arthritis you got. Do that. Let's change what you are eating. And as I became a student of the effects of plant-based diets on various medical maladies, these 9 conditions that most of us wrestle with on a daily basis on our patients, no matter what the specialties are, all of these will respond beautifully to a diet of whole plant foods. And I'm going to be talking specifically about atherosclerotic vascular disease and type 2 diabetes in a few minutes. Why does this work? How does this happen? What are we looking at here? This is such a remarkable phenomenon. I owe you folks an explanation about how this can happen. Otherwise, you just got to take my word for it. I don't want you to take my word for it. I want you to understand so you can have the confidence that when you are prescribing a healthy diet for your patient, or when you are dealing with everyone from administration to the city of New York, you can have confidence this is powerful healing medicine that deserves to be implemented fully in your private practice and in your public policy. So how does it work? I wish when I was a medical resident, some attending physician, some chief resident sat me down and said, look, in a few minutes, you're going out into outpatient clinic. And you're going to see this steady stream of patients, overweight, hypertensive, diabetic, clogged up and inflamed in bodies that they want you to do something for them to restore their health. You got to understand why they're sitting in front of you in those bodies. So let's get real about the American diet. Most people are eating the standard Western diet, bacon, eggs for breakfast, cheeseburger for lunch, fried chicken for dinner, dairy products through the day. You eat a meal like this, and an hour later, I sneak up on you with a needle and a syringe and draw 5 cc's of blood into a red top tube, let it clot, put it in the centrifuge, spin it down, and have a look at it. The serum in that red top tube looks cloudy and milky white. Of course, this is postprandial lipemia. It's largely triglycerides and saturated fats, cholesterol. It's largely the fat of the animals the person just ate. And the truth is, well, not everybody shows the fat this optically densely, but everybody has a wave of fat that goes to your bloodstream after you eat a fatty meal. How can it not? And your blood stays this way for 5 hours. And the sad reality is that most Americans, because we are a wealthy country, hunger is not tolerated. If you get it all munchy and hungry, if you're at home, you put your head in the refrigerator for last night's dinner leftovers. And if you're out and you get a little growly, you head for the restaurant, the convenience store. And the truth is most Americans are keeping themselves postprandial all day. And when you open the door of the waiting room of your clinic, most people are sitting there with blood like this. Most of them just ate in the last hour or two. And this is the truth of their bloodstreams. Now, when the blood is running thick with fat, evil things are happening in the vascular system. Your atherogenic LDL is increasing. The blood is more viscous. The fat coats the red blood cells. They start sticking together. The blood viscosity goes up. And viscous blood does not deliver oxygen and nutrients as efficiently. It also takes a higher pressure to force viscous blood through tiny capillary beds. So blood pressure goes up. The fat flows through the abdominal fat stores and sticks there, increasing obesity. I'll show you why that's a problem in a minute. The fat works its way into liver cells, muscle cells, clogging insulin receptors, and that's the driving force behind insulin resistance. We'll explore that in a minute, but that's why they're walking around with high blood sugars. And the saturated fats are pro-inflammatory, and so it drives inflammatory reactions throughout the body. And as we're all becoming aware, this low-grade percolating inflammation in the body is a driving force in most all the diseases we're treating, everything from arthritis to psoriasis to depression. There's an element of inflammation in it. And again, surges of saturated fat every few hours keeps those inflammatory fires burning in the tissues. Now, I focused initially on the fat because it's the most visibly obvious. But there's a lot more than fat in that blood after you eat a cheeseburger, that's for sure. You have a surge of molecules through the bloodstream that I call the postprandial red tide. And let me quickly go through this list, but these molecular marauders are the battalion of disrupting molecules that cause so much metabolic chaos in our body. First of all, it's a high sodium diet. There's salt in the chips, salt in the cheese, salt in the spaghetti sauce at the Italian restaurant. It's a high sodium diet. That not only raises blood pressure, but we now know that high sodium diets stimulate Th17 helper cells that open the door to lupus and autoimmune diseases. It's a high sugar diet. There's a sugar obviously in the donuts and the cakes and the candies and the soft drinks, but the ketchup has sugar, white bread has sugar. It's a high sugar diet. Well, those sugar molecules attach to proteins and they glycosylate the proteins. The proteins stick together. You get cross-linking of your collagen proteins that stiffen them. They fracture. It ages our skin, ages our blood vessels. Eating sugar as a food is not a good idea. Saturated fat, as I mentioned, is pro-inflammatory, raises LDL levels. fragments of the animal muscle in the burger and the eggs get out into the bloodstream and flow through joint membranes, initiating inflammatory arthritis. Frying the foods inevitably creates free radicals. And remember from chemistry, these are atoms that are missing an electron. They will rip an electron off any passing molecule, including your DNA, your cell membranes. Fried foods, processed foods are filled with free radicals, as are the advanced glycation end products. The very act of cooking meat, grilling the burger, broiling the steak, frying the chicken. This creates advanced glycation end products teeming with free radicals that cause molecular damage throughout the body. The emulsifiers, the polysorbate 80 and all those other ingredients, the carrageenan that you see on the ingredient label of these processed foods, they give the ice cream good mouthfeel, they keep the candy bars soft, but they also dissolve the intestinal mucus lining your digestive system, and that's going to increase the permeability to molecules getting out into your bloodstream that you do not want out in your bloodstream, bacterial cell walls, fragments of food proteins. The very act of cooking the meat, of grilling the burger, frying the chicken, broiling the steak, oxidizes the cholesterol in the animal's muscle. And it's the oxidized cholesterol particles that are the most atherogenic that work their way into the walls of the arteries, initiating plaque formation. Endotoxin. All animals pass through the slaughterhouse, even organic grass-fed beef. And as the digestive system is eviscerated, you inevitably get spillage of gut contents. You can take a culture tube from the microbiology lab and swab any cutting surface in the meatpacking plant, and you'll get a luxurious growth of E. coli, Salmonella, Shigella, Pseudomonas, Enterococcus, the whole rogues gallery of enteric bacteria wind up as a coating on the surface of every steak and chop and chicken breast that leaves the meatpacking plant. It's wrapped in plastic, and in the meat case of your supermarket, the ultraviolet light shines down and kills those bacteria, yay, but as those bacteria die and their cell walls break apart, they release this nasty lipopolysaccharide called endotoxin, and it makes your gut leaky, it releases histamine, it depresses your heart muscle, makes your blood clot, nasty stuff, endotoxin. Those of you who've worked in intensive care units know endotoxic shock. Endotoxin is heat stable. Grilling the burger does not get rid of the endotoxin. And our paleo friends and our keto patients are giving themselves a shot of endotoxin 3 times a day. Inevitably, cooking the meat creates carcinogenic heterocyclic amines that smear on the stomach lining, giving gastric cancers, on the stomach, on the gut wall, giving lower GI cancers. When you eat meat and other high protein foods, all those amino acids flow up into the liver through the portal vein system, and the liver says, building blocks, let's build something with them. And the liver responds with a surge of insulin-like growth factor 1, one of the most potent growth promoting hormones in biology. And if you're an 11-year-old girl growing up, boy, you want lots of IGF-1 in your body. But if you're an adult woman with an early stage breast cancer, or you're a guy with a big prostate and some malignant cells in the middle of it, the last thing you want is a diet that makes you walk around with high levels of IGF-1, but that's exactly what the current meat-based diet does. Heme iron makes red meat red due to the Fenton reaction. It stimulates oxidation through the tissues. Reactive aldehydes, again, broiling the steak, grilling the burger, oxidizes the glycogen and the nucleic acids in the meat, and that's going to generate these reactive aldehydes, acylacylate. They are mutagenic. They damage your genes. You're just having lunch. You don't want to damage your DNA, but that's exactly what eating the burgers and the fries and the hot dogs and the buffalo wings do. Steaming broccoli does not create reactive aldehydes. Boiling rice does not create reactive aldehydes. Eating fruit does not create reactive aldehydes. A whole food plant-based diet doesn't generate these things. But when you are eating animal flesh 3 times a day, like our paleo patients and our keto friends are, they are sending surges of these reactive aldehydes through their DNA. Nu-5GC, this is a sialic acid that only animals make. It drives inflammatory reactions throughout the body. And again, our paleo folks are eating U5GC 3 times a day. And the animals in the feedlot are fed bushels of grains that are sprayed with herbicides and pesticides. They drink water with lead and cadmium and mercury. And they're given hormones and antibiotics that promote growth. All of these substances accumulate in the animal's flesh. So every drumstick, your finger licking good that you bite into, every burger, you're eating the bioconcentrated toxins that that animal is fed. These are just some of the molecular marauders that surge through every tissue, every cell in your body with every cheeseburger, every slice of pepperoni pizza. Doesn't happen with rice and beans and greens and fruits and vegetables. Difference between an animal-based meal and a plant-based meal, which I'll show you in a minute, is a difference between 1 and 0. It is so profound as far as the effect it has on the body. Again, it's a fatty tide, it's salty, it's sugary, it's antigenic, it's full of phosphates and sulfates that turn into phosphoric and sulfurous acid, mutagenic, carcinogenic, atherogenic, pro-inflammatory, and disrupts enzyme reactions throughout the body. This is what our patients are doing to themselves every 4 hours, month after month, year after year. Now, just because one is eating vegan doesn't necessarily mean you're eating healthy. And vegan junk food is also filled with salt and sugar and AGEs from cooking the flour products and outside vegetable oil. And a processed food vegan diet full of junk food is certainly not healthy. But again, once you add meat to the diet, you add an entire new tier of toxic molecules that are causing molecular mischief throughout the body. And do the math. If you eat 3 times a day in this style, that's over the course of a year, over 1,000 times a year, you're flooding the red tide through your tissues. Can we seriously say this has no effect on our patients? No causative role in the diseases they bring to us? I was told they don't. Patients died. It doesn't matter. It doesn't have any effect on it. Never been any studies to show it makes any difference. Doctor, in this day and age, how can we say that with a straight face to our patients? And when we're in clinic, in that clinical setting, and you open the door in the exam room or in the ER, and you see the man with the angina pain and the lady pulling on her albuterol inhaler for her asthma, and the man with the type 2 diabetes injecting insulin, and the lady grieving over her acne-scarred skin. Etiology unknown. We don't know the cause. Really, doctors, are we not looking at the repeated red tides flushing through these people's bodies month after month, year after year? Don't the food effects over time create these health effects? Well, medicine did not want to look at it. All sorts of cultural reasons, economic reasons, traditional reasons. Oh, we don't ask about patient diet. That's cultural. That group eats meat and cheese. That group fries chicken. Can't talk about that. It's time we started talking about it. That's why they're sitting in front of us, doctors, and that's why they go ahead and continue getting their heart attacks and strokes and cancers. And the tragedy is these are largely reversible diseases, and they can go away right before your eyes. And that's the most exciting transformation in medicine. So why does this happen? What is the phenomenon we are looking at? Here is the payoff. Okay, here's why these people undergo these remarkable transformations. Here we are, the patient's still eating the burgers and the french fries. The french fries are bad enough, but the burgers and the buffalo wings and the pepperoni pizzas, etc., flooding the red tide through their tissues every 4 hours. Finally comes that day. They are getting out of the shower in the morning, they catch a glimpse of themselves in the mirror, and they don't like what they see. They don't like the big protuberant abdomen, they don't like the sore, swollen joints, they don't like the medicine cabinet full of pills, and say, I got to do something about this. I can't keep doing this. I got to change something. And so the appointment is made, and soon they're sitting in front of you in the doctor's office saying, tell me what to do, doctor, please. I know I'm headed for something bad. What can I do to change the course? Well, knowing that what you're learning here and what if you educate yourself and with the materials I'll be showing you, you would say the first most important thing to do, let's change your diet to a predominantly, it doesn't have to be pure vegan the next day. Be nice, that's the most effective thing to do. But start eating a diet mostly of whole food. Have a big salad every day, hearty vegetable soups, big plates of greens, And we'll show you, like the food at True North, come as close to that as you can. As soon as the patient says, okay, doc, I'm in, as they say in New Zealand, boots in. I'm committed here. I'm off the animal train. I'm on the plant-based train. As soon as they say that, here is what happens. The first and most important thing of all is that the red tide stops. That every 4-hour assault on the tissues, on the biochemistry, on the physiology, on the microbiome ceases. There's respite. Now repair can start happening. You know that every cell in your body has instructions imprinted on the DNA to repair cell membranes. You all know the latest findings have shown us that on our DNA strands, we have these proteins called DNA editing enzymes that spend all day going up and down our DNA strands looking for genetic damage. And they look for nucleotide mismatches. And when they find them, they fix them. Don't ask your permission, they just fix it, all right? But they can't do their repair function effectively if every 4 hours there's this surge of vegetable oils and AGEs and high fructose corn syrup and free radicals. And if the red tide's flushing through there every 4 hours, they're not going to be able to repair the cellular damage. Now they can. And repair happens because, one, the respite from the onslaught happens. But most importantly, these molecular marauders are now replaced by a totally different surge of phytonutrients that have the exact opposite effect. First of all, this is a high water content diet. All the soups and the salads and the fruits and the vegetables are full of water. And now there's more water in the blood, so the blood flow is more watery. It's less viscous. The blood viscosity goes down, and that's going to increase the delivery of nutrients and oxygen. There's a surge of free-flowing blood through all the capillary beds in muscles, brain, heart, kidneys. And it's a notable medical or measurable phenomenon. When they check the blood viscosity, folks who don't eat meat have significantly lower blood viscosity. Your blood is more free flowing. And that now interacts with another effect in that all the dark green leafy vegetables, all the kale and the broccoli and the chard that you're now eating, increases the production of nitric oxide in the walls of the arteries. And that's going to produce a very subtle vasodilation, just a little bit, but it's a very important little bit because of a law in physics called Poiseuille's law. And Poiseuille's law says, sorry for the equation here, but the flow of a liquid through a tube, through a pipe, now will increase by the 4th power of the increase in the radius. And so if the radius increased by a factor of 2, the blood flow, if it's an artery, will go up by a factor of 2 times 2 times 2 times 2 by a factor of 16. And you know it yourself. If you're trying to suck a liquid up through a skinny straw, a straw even twice the diameter gives a whole lot more liquid. Well, that's what's happening in arteries throughout the body. And there's now less viscous, more free-flowing blood brings a surge of nutrients and oxygen to all the tissues. When you pull out the animal flesh from the diet, you're pulling out the arachidonic acid. And that is the main driver for prostaglandin 2 production, which is the main inflammatory prostaglandin. When you pull all that out, now all the fats are coming from plant oils, many of which are in the omega-3 family that have an anti-inflammatory character. So you've changed the entire inflammatory balance of tissues throughout the body. That is so profound when it comes to inflammation. And all these colorful fruits and vegetables are filled with antioxidants that quench free radicals, ROS, reactive oxygen species of free radicals. And so all those free radicals in the tissues from the sugar oxidation and the fryer oil and all that stuff, they're quenched. And so the oxidative damage in the tissues is much, much less. Change the food going through the gut, you're going to change the microbes that live in that gut. If you are eating meat and eggs on a regular basis, you are fostering the growth of some nasty bacteria in your gut from the Bacteroidetes phyla. These are unfriendly critters, and they put out byproducts that injure the gut wall, increase gut permeability. Well, you pull out the animal flesh and the eggs, And now all the material coming down the gut is plant fiber and the resistant starches from the beans and the peas. And that's going to foster the growth of beneficial microbes from the Prevotella phyla. And these are anti-inflammatory in their byproducts. Not only that, many of their byproducts are neurotransmitters that make you feel good. And these critters put out norepinephrine and dopamine and serotonin and oxytocin. And I've had many patients say, gee, when I went plant-based my diet, I feel better, I feel more positive. That's not a placebo effect. That is a gift from the refurbished microbiome. When you stop eating other animals' cholesterol, your own lipids are going to improve and your saturated fats will decrease. So there's going to be less atherogenic lipids in the blood. Endotoxins should essentially disappear. No endotoxin on broccoli. There should be no endotoxin in a fruit salad. The skin oils, often guys say, gee, my wife says I don't smell anymore, I don't stink anymore. And that's the fact that from the plant oils are now working their way into the skin oils that are less odoriferous as they oxidize. Hormone level is really important. I hope everybody knows that the American dairy herd has been genetically modified. When I was a boy on my uncle's farm in Wisconsin, we milked 49 cows. And when one became fertile, we'd lock her up in a stanchion and call the guy from Badger Breeders who would ram a tube of bull semen up into her uterus. No cow liked that procedure. But then she would conceive, and if she had been lactating, giving milk, she dried up, she stopped. Pregnant mammals do not lactate for a good biological reason. And there's nothing we can do about it. Uncle Charlie Applause notebook, bossy number 14, will not be milked until she has her calf in the spring. And that's just the way it was back then. Nothing to do about it. Well, today's modern dairy operation, they're milking 1,000, 1,500 cows twice a day. They can't afford to have their best milkers go offline for 9 months while they're carrying their next calf. So they genetically modified the dairy herd, and now all the cows in the dairy are pregnant, and they're carrying with their next calf, and they're still sucking milk off these large, pregnant bovines. Well, any woman who's been pregnant here knows what it's like to be pregnant and have your whole body full of estrogens. It certainly affects breast and uterus and hair. Well, the estrogens gets into the breast tissue, and it gets into the milk. And today's modern dairies are putting out milk that has lots of estrogens in it. And these are not the puny little phytoestrogens in soy. These are official mammalian estrogens. This is estrone, estradiol, estriol, pregnanediol, progesterone. And they have effects. And they increase breast lumps in women, make guys' prostates unstable, give guys man boobs, give women fibroids. I tell my patients who are still eating dairy, go look in the mirror. Are you a baby calf? Do you have a big snout? Do you have big ears? Do you have whiskers? If you're a baby calf, cool, man. Enjoy your yogurt and your ice cream. If you're not a baby calf, consider not drinking baby calf growth fluid, which is what cow's milk is. And there's so much else to pour in your cereal these days, all these wonderful plant milks and plant cheeses, etc. So the hormone levels normalize. Kidney function improves. High protein diets with all the bodybuilders, they are not friendly to the kidneys. When all those amino acids slam into the glomeruli, it hurts those filter membranes, and the glomerular membranes thicken, the glomerulus goes into a state of hyperfiltration, and as the months and years go by, it leads to chronic kidney disease and often to dialysis. The asthmatic folks wheeze less, their mucus is less viscous, and white cells go down to 3,000, and I get called, my doctor wants to send me to a hematologist, my white cells down to 3,000. That's a normal white count. If you're not priming your bone marrow with endotoxin 3 times a day, your white count's going to go down, and it's a good thing. It's not a bad thing. These are just some of the changes that happen in every organ, every tissue in the body when one changes from an animal-based food stream to a plant-based food stream. It's the difference between 1 and 0 in computer analogy. If someone asked me, doctor, in one word, tell me what changes if you go from an animal-based food stream to a plant-based food stream? What changes in a word? Everything changes. It's an entirely different physiology. The microbiome is different. The extracellular fluid is different. The blood lipids in the circulation, everything changes. And that's why these remarkable changes that I showed you in the True North patients happen. The body just got restored back. You know, if you've been pouring diesel fuel into a gasoline burning engine and you got black smoke coming out of the exhaust and carbon caking up your spark plugs, oh, my car's developed a disease. No, it hasn't. It's now functioning exactly as we would expect from putting the wrong fuel in an engine not designed to run on it. Well, we are not carnivorous apes. No other primate eats animal flesh 3 times a day, feeds their young animal flesh 3 times a day. It's bizarre and it's pathogenic, as we're saying. This just allows the natural healing forces to prevail as they should have been all along. And I could spend 2 lectures on going through each of these organ systems to show how they benefit from changes on a plant-based diet. I don't have time to do that. But can you get enough protein on a plant-based diet? Yeah, absolutely. The beans and peas and chickpeas and lentils and nuts and seeds are full of protein. Yeah, it's easy. 3 meals a day on whole plant foods, you can easily get 80 grams of high-grade protein or more. Protein deficiency, I've never written that as a diagnosis in 50 years of medical practice. So let me just talk about these 2 specific diseases, about why they benefit from a diet of whole plant foods. Disease aversion in cardiology that most cardiologists do not want to, or they just don't usually consider, but they should. You know the grim statistics. Every 40 seconds in this country, 1,000 times a day, a fellow American grabs their chest and falls over with a heart attack and dies because a plaque in their coronary arteries is torn open, initiated a blood clot that obstructs blood flow distally. You get infarction of the muscle, it's electrically unstable, they go into ventricular fibrillation and die. 300,000 of our fellow Americans die every year in this way. They don't have to. This is a reversible disease. Dr. Caldwell Esselstyn demonstrated this conclusively on a number of studies. He gets folks on a whole food plant-based diet and has them eat green vegetables, like kale or broccoli, several times a day. And that acts as time release capsules in their intestine that are constantly releasing antioxidants into the bloodstream. He's published a number of articles on how this will reverse plaques. All these beneficial changes happen. And what we see clinically, the plaques get smaller and smaller and smaller. The endothelial lining reestablishes itself, and you wind up looking at arteriograms like this. This is the left anterior descending artery in a man's heart. As you know, it's filled with angiography dye, and the whole artery should look like this. But this rat-eaten portion, these are atherosclerotic plaques encroaching into the blood flow channel. This man did not want surgery. In fact, there was no place for the surgeons to plug in the graft downstream, and did not want to go on statins. Went on a whole food plant-based diet with lots of greens. Took 29 months of soups and salads and steamed veggies, but the plaques melt away, and this artery turns into this artery. The plaques have melted away. The man is free of angina and is off his medications. Why didn't somebody tell me that this is a reversible disease? Not only that, as you well know, if you've got plaques this severe in your coronary arteries, and you've got them in your carotids going up to your brain, you've got it in your renal arteries going to your kidneys, you've got in your femoral arteries down to your legs, and just bypassing a stenotic area in the heart, you've not cured the patient. We got to stop kidding ourselves. This is a total body disease. You've got to clean out the arteries on a large scale. And when these plaques begin to melt away a little bit, and the artery walls start to dilate from increased nitric oxide production, Poisson's law kicks in, and you get a surge of blood flow. This is a myocardial perfusion scan of heart muscle, and red is good blood flow. You can see how choked down the blood supply is. The man went on a whole food plant-based diet for 2 weeks only. But the arteries relaxed and dilated a little bit, and within 2 weeks, this perfusion scan turns into this perfusion scan. The responses are often very prompt and very dramatic. So I saw this first report in 1977. A 65-year-old man, severe angina, had to stop every 9 or 10 paces, went on a plant-based diet. 6 months later, he's climbing mountains in the Lake District in England. And arteries all over the body open up, much to the delight of people at home. I'm sure this woman is delighted that his retinal arteries are now delivering more blood to his eyes. There's now getting to be a substantial literature showing up in the medical journals. Almost hard to find a journal article, a journal issue that doesn't have some article referable to the benefits of a plant-based diet, angina claudications, but also hypertension, heart failure, kidney failure. They all improve. And it forces the doctor to learn a skill that no one mentioned to me in medical school called deprescribing. You got to get these patients off these medications and do it artfully so they don't suffer rebound problems. It can be done. Now, when I talk to the cardiologists about this, I say, look, doc, that's all very nice. It's California woo-woo stuff. I'm a busy guy. I got a waiting room full of patients with vascular disease. I don't know anything about this stuff. It's easier for me to give them a prescription for statins and a shot of Repatha, and don't bother me with all this food stuff. Yeah, you can pound those cholesterol levels down, but one, we see that the actual reduction in absolute risk reduction is tiny. These folks still go on to get heart attacks and strokes. And it also gives them a false sense of security. Oh, my cholesterol's 118. I can keep eating those burgers and buffalo wings and pizzas. And as a result, they find themselves in the same predicament that the paleo patients do. And, come on back here, paleo man. Let me see if I can, where'd he go? Oh, no. Knock this out here, no.
That's right.
Out, yeah, let me come back here. Sorry about this. We're coming down the home stretch here, folks. I know it's a lot of stuff, but stick with me. It's worth it.
Presentation stopped for some reason.
Sorry. So the problem with the paleo diet is these folks keep shoving cooked animal muscle down their gullet 2-3 times a day. As you'll see from this slide, and in my book, that's a recipe for an epidemic of colon cancer. All the trimethylene oxide you're going to be generating is going to give an atherosclerotic disease, heart attack, strokes. All the endotoxin they're consuming is going to get leaky gut. That's going to open the door to lupus. The oxidized cholesterol, because they're cooking the meat, the oxidized cholesterol is going to contribute to vascular dementia. This is a diet of death.
Gotta use the mic.
Yeah, Mike.
Microphone.
Microphone, sorry about that. You have to say that again. Okay. The problem is the people with the paleo philosophy who give themselves license to eat animal flesh 3 times a day because they think that's what the cavemen ate, which they did not. That is a myth. We know that for several reasons. One, most hunts were unsuccessful. Most times the guys came back empty-handed. If they did drag a carcass into camp, there was no refrigeration. It rotted within days. And when we look at the fossilized fecal droppings, thank you, of the paleo folks, they're huge. These folks were eating huge amounts of fiber because the majority of calories brought into the Paleolithic camp were gathered by the women who spent all day digging up starchy roots and tubers and gathering berries and nuts, etc. We were starchivores back then. We are starchivores now. This whole paleo myth is a myth, but it gives Joe steak eater rationale as what the caveman ate. Well, he didn't, but packing your colon full of meat 3 times a day is a recipe again for colon cancer. The TMAO is going to give them heart attacks and strokes. The endotoxin is going to give them lupus. All the fat's going to give them type 2 diabetes. The microbes they're going to spawn will give them Crohn's disease and colitis, and the oxidized cholesterol will give them vascular dementia. But when you're 28, you can eat linoleum glue and think you're getting away with it, and so they don't see it. But believe me, the sword of Damocles is going to come down on these young folks who are following this type of philosophy. I hope Joe Rogan is able to explain what when his patients, when his viewers start dropping out from these diseases. So a patient says, "What do I do, doc? Where do I start? How do I make it? What's step one? What to do?" Well, if you've not seen a film called Forks Over Knives, please go to forksoverknives.com, see that film. The fork is your dinner fork, the knife is a scalpel going down your chest for a bypass. Believe me, you want the fork over the knife. Trust me, I'm a doctor, you want the fork over the knife. And then go back to the website, they've got great ideas for transition plans, etc. Have a salad every day. Let's do that. And instead of a 16-ounce porterhouse steak, why don't we get the meat down to the size of a deck of playing cards and fill the rest of the plate up with vegetables? There's a great little book called For Fork's Sake by Rachel Brown. It's skinny. You can read it in 3 hours. And she takes you shopping. This is what you need in your house to make a breakfast, a lunch, a dinner. It takes the reader by the hand and helps them make these early steps they need to. So type 2 diabetes that all of us wrestle with here. Oh, sugar is from eating too much sugar. No, it is not. The sugar is the tail of the dog. It's not the cause. The cause is all the fat in the diet. You keep your blood fatty meal after meal, bacon and eggs for breakfast, cheeseburger for lunch, chicken for dinner, all that fat in your blood, day after day, week after week, works its way into the liver cells and into the muscle cells. And it becomes intramyocellular lipid. It's not theoretical. This is what it looks like in striated muscle. This black stuff is fat in the muscle cell. And it inhibits the kinase enzymes that make your insulin receptors function. So people eat sugar, insulin knocks on the door, but nobody answers there. And the sugar builds up in the bloodstream. But the high blood sugar is the result, not the cause. And there's getting to be a strong literature about intramyocellular lipid and its role in insulin resistance. And if the person happens to have an obese abdomen, that adds another layer of insulin resistance. And people are sensitive about fat shaming. I'm not fat shaming. We are an obese nation now. And the reality is the fat in the abdomen is not inert. It's metabolically active. And it pumps out inflammatory cytokines like interleukin 1, interleukin 6. And it generates what's called metabolic inflammation. And obesity-related inflammation is a driver in insulin resistance. We have to stop. Well, you can be fat and still be healthy. Not in my book. In my book, obesity is a state of inflammation. And we know that inflammation drives a lot of disease states. So here's the person whose insulin receptors are inhibited from the inside from the intramyocellular lipid. It's interfered with on the outside from the inflammatory cytokines. No wonder so many obese people develop type 2 diabetes. The good news is it is reversible. You get these folks on a low-fat, plant-based diet, lots of soups and salads and greens and steamed veggies and curries and soups and stews. And this is a reversible disease. The fat in the muscle cell gets burned for energy. The insulin receptors are freed up from the cytokines. And folks on plant-based diets compared to the Diabetes Association diet, their A1C improves more, they lose more body weight, their lipids improve, their kidneys heal, they spill less protein. Jim was a patient on 30 units of insulin. Went plant-based over 2 years. He dropped 100 pounds, and now he's running marathons and off his insulin. And again, there's getting to be a significant literature supporting the reversibility of type 2 diabetes, not just a matter of more metformin and glucose monitors. We want to heal these patients and get real about the role of their diet and how you can reverse this disease. And again, you have to learn how to deprescribe the hypoglycemic agents, a lovely task. And in this age of Ozempic, I have to shake my head at $1,000 a month, and the weight comes right back when they stop taking the drug, and they can wind up with a permanent gastroparesis. All they need to do is go on a diet, not diets, just start eating a food stream of whole plant foods. And as I said, the calorie density is so low, you can't hold weight on this food. You get lean eating this food. And they can eat all they want. And it's so dishonest. Boy, you see those commercials come on at dinner time on the TV, and you need Ozempic. They made a disease out of an effect of our pathogenic diet. Just eat human plant food, and you don't need the Ozempic. It's an anti-inflammatory diet, and it's especially effective in autoimmune disease. If you've got patients with lupus, ankylosing spondylitis, I urge you to get the book by Dr. Brooke Goldner. She's a physician who put her own lupus into remission. She was bad. She was on kidney failure and having strokes, and she reversed her own lupus with a diet on whole plant foods, and she shares it with you in this wonderful book. And she's got a great website called Goodbye Autoimmune Disease. The red tide sloshing through the gut is not gentle with the gut mucosa, and these are inflammatory molecules, and they are notorious for setting off colitis and Crohn's disease. But a diet based on whole plant foods lets you taper off the prednisone, and it's step one. It's not all you have to do, but it's step one in putting these people into remission. The asthmatic folks wheeze less, especially when you get the dairy out. Here's all these skin. The psoriasis will slowly but steadily clear up often. Do you have to be 100% vegan? No. And if you have a little piece of animal flesh once or twice a week, probably lightning won't come down from the sky and strike you dead. But the food stream itself, the meal should be whole food plant-based. If you want to add a little animal flesh, I'm not going to quibble over it. But less is more when it comes to that. And some people may need to taper off over months. That's fine. Better to eat the stuff twice a week than 3 times a day. But no one mentions this to us. During our medical education, we just go right ahead to, we see our patients, we put a diagnosis on them, and then get them on the right medication or refer them to the right specialist. And so it leaves the patient asking, why does my doctor know anything about nutrition? No one teaches us about it. It's not respected as a real science, a sissy science. Send them to the dietitian, don't bother me. I'm in the operating room doing real medicine. But what are you doing in the operating room, doctor? You're dealing with the infarctions and the infections and the amputations from what your patients are eating. You're all dealing with diet-based diseases. Plus, the folks are eating the same food themselves in the hospital cafeteria. So the patient's diet never mentioned. Business as usual. Business as usual is a losing proposition for everyone. Most importantly, the patient loses the chance to truly reverse their disease. They never hear those words. How would you like to reverse your hypertension? How would you get off those meds? How would you like to reverse your diabetes? They don't hear those words. What a crime against our patients by not offering this to us. Oh. Whoever, okay, fine. The doctor loses the satisfaction of seeing their patients get healthy. I mean, why are we going into medicine if not to restore our patients to health? And so we lose that opportunity. The medical system loses billions and billions of dollars. I used to do anesthesia, and these patients come in for these 4-vessel bypasses. They often have these rocky post-op courses. They get post-op infections, and pneumonias, and blood clots, and wound dehiscences. And they leave with a $500,000 bill to head right for McDonald's and start eating more Big Macs and clog up their graft. And they come back in because nobody talks to them about the effect of their diet. And that money is down a black hole. That money could be used to fix the roads, to send kids to college, to put internet in everybody's house, to pay down debts. That money could be used to really help society. Instead, we're just promoting the cheeseburger eating. Every time one of our citizens goes down with a heart attack or stroke, society not only loses a productive citizen, they lose a taxpayer. And so we all pay for that. The farm animals lose their lives, 80 billion a year, have their throats cut because we like the way their flesh tastes, not because we need it nutritionally. And the planet loses because large-scale animal agriculture is the driving force. That is why we're cutting down the forest, polluting the rivers, and driving global warming. The savings would be spectacular, both monetarily and reduction in human suffering. So I asked my colleagues, you ever talk to your patients about nutrition? They scoff. First of all, I wouldn't even know what to tell them. And I know nothing about the subject. Second, I don't get paid to do this counseling, and I don't have time to do this counseling. I got a whole waiting room full of sick people here. Well, the good news is, what I'm trying to share with you is you don't have to, doctor. There are trained professionals who would love to do this counseling for you. Before I came here today, I did a Google search on plant-based dietitians in New York who take insurance. And look who shows up on the screen here. Every location I give this talk in Massachusetts, here's the dietitians here in Houston, Texas, in Broward County, Florida, in Ontario. There's plant-strong dietitians everywhere, and they would love to do this counseling for you. And they don't even have to be in the same city. That works by telemedicine just beautifully. So what I'm advocating here is a new model of primary care medical practice. The dietitian is brought on to the primary care treatment team because that's where she belongs. You're dealing with patients with diet-related diseases. I tell the doctors, practice good medicine. Take a medical history, do your physical exam, order your labs, get a diagnosis, get them on the right medicine, practice good medicine. But before you let the patient leave, I said, before you go, I want you to go down and see Miss Wilson in room 421. She's the plant strong dietitian. She's going to talk to you about what to eat, she's going to give some handouts, show you some videos. You eat like she's telling you, and you come back and see me in a month. Let's see if you're not leaner and healthier. Let's talk about getting you off these medicines. That is how medicine should be practiced in the 21st century. I've joined a clinic up in Victoria, British Columbia, and everyone sees the doctor, and the next stop is the plant-based dietitian. The Canadian government pays for that, but again, the insurance plans here pay for that. We need to bring the dietitian into a rightful place on the primary care treatment team. There's no end of healthy support available, lots of jumpstart programs. You've got them in this hospital. And I tell the medical students, be appropriate. Don't walk into clinic wagging your finger at the professor. Don't you know you're killing your patients if you don't have them on plant-based? Don't do that. This is very disruptive ideation here. This is disruptive to their understanding of disease. It's disruptive to the medical structure of medical practice, and to their financial structure. It's threatening. This is going to be a slow but steady evolution. However, there's lots of information, and I urge people to educate yourself. There's now some excellent books on plant-based nutrition and clinical practice. American College of Lifestyle Medicine has lots of free courses to take to educate yourself. I urge you to join the ACLS. Plantrician University, a wonderful organization that has a plethora of plant-based courses to take free of charge. University of Winchester has a 6-week online course on plant-based nutrition. There's a journal now of disease reversal. It's a thing. Subscribe to it. It's a free journal. I urge you to take advantage of the information. And to the med students, you want to get those medical powers. You want to learn how to use diuretics to make that edema go away, antibiotics to make that cellulitis go away. This is the most powerful clinical tool you will ever wield. Actually reverse these diseases. What more could you want from your clinical practice? Well, Americans aren't going to change what they eat. Yes, they do. It's the 21st century. They're sick and tired of being sick and tired. This is my patient, Ken, came in on 2 medicines for blood pressure and diabetes. 12 weeks later, dropped the weight, dropped the blood pressure, dropped his pills. Again, urge you to, if you need to start with forks over knife and for fork's sake. So we're just about the end. Okay. If you ignore the patient's diet, you are condemning yourself to be like the blind man and the elephant, where every medical specialist is in their cubicle, and the cardiologist is treating the clogged arteries, and the endocrinologist treating the diabetes, and the gastroenterologist treating the IBD. They think they're treating different diseases. they're all dealing with what their patients are eating. And the tragedy is that a whole food plant-based diet can reverse these diseases. So educate yourself on the issues, improve your own health, have a look at what's coming up on the Trace of Dietary. You guys are doing a great job. What a pioneering organization this is. Look at what's being eaten at the nurses' station. Look at what you don't have a McDonald's in the lobby. That's great. But so some of you are going to find hospitals that do. Set a good example. They say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. So at the end, I'll ask that provocative question. Knowing how reversible the majority of diseases you're going to spend most of your careers treating, knowing how reversible they are with a diet of whole plant foods, and it's not all you have to do, but it's the very first most powerful step. You want to heal these patients, or you just want to manage their chronic disease. If you're just going to manage their diabetes or manage hypertension, you're going to leave medicine. It's a dismal way to practice medicine. Want to see these patients get healthy, then get to the cause of their condition, and it's delicious to eat. So this is the report from the front lines. It's the food. It's been the food all along. These are reversible diseases, and a plant-predominant diet is the key. So the plant-based wave is breaking. Line up your surfboard, learn all you can about it, and take it and share disease reversal with your colleagues and your patients. I'm the happiest doctor I know. My patients get healthy. You can be the healthiest and happiest doctor you know as well. If you'd like to take our feedback survey, that would be great. Otherwise, I will thank you for your time.
So we don't have time for questions, but I just want to thank you so much. I think undeniable how important this talk was for everyone to hear, and I hope it is a springboard for further thought and investigation and a journey that we're taking as an institution and as individuals. I just want to introduce you to somebody from plant-powered NYC, Rita Saka. She's just going to spend one moment talking about plant-powered NYC and one of those resources that you all can avail yourself of. In fact, in this hospital have been enrolled in Jumpstart. For just 2 seconds.
Thank you so much. And Dr. Klaper, I am in total gratitude to you because 10 years ago, I heard your message. I heard your voice. I heard you say, it's the food. I listened and I started crowding out my plate and doing things slowly. And I reversed my colitis, which I suffered until from the age of 6, actually, started learning out. But it was in 2017 that I completely educated myself in the Cornell course, and I took it a step further and did it 2 level better. And I realized that 2 or 3 weeks into following it to the science, getting me traction, wow, this is unbelievable. This is really the science of health and wellness. And I went on to a member of Planned Parenthood in New York. And it's there that we educate and support people. So if you would like to support Dr. Klaper in this message, please join us. We educate both in plant-based nutrition. It's transformative. We have community-based, we're online. And we also have, you can find us on social media and on our website, you can join our mailing list. And Dr. Klaper will also be speaking publicly on Saturday at 4 p.m. At a church in Northern Canton. And you can find the details on the website and social.
Have recorded this talk. We're going to put it up on the intranet at some point in the next couple of weeks. So all of the websites and contact information will be there. And I'm sure if somebody wants to email you some questions from your team, they can do so. So thank you all for coming. Enjoy your day.